Welcome to 15 and 100, a 100-day movement that ends on the 15th anniversary of our founder's sister's death. Participate now through December 10, 2022. Welcome to our presentation, your first neuromuscular breathing appointment. In our first part of the presentation, we looked at when to have the appointment. In part 2, we're going to explore what happens at the first neuromuscular breathing appointment. A neuromuscular breathing specialist will perform non-digital spirometry or pulmonary function testing, PFT, to measure vital capacity, VC, or forced vital capacity, FVC, and some additional measures that will look at breathing muscle strength. Those include maximum inspiratory pressure, MEP, and maximum expiratory pressure, MEP. They'll do this in different positions. They'll have you lie down, they'll have you seated, and if you use a brace, they will ask that you wear that brace for these measures. They'll also use a peak flow meter to at least measure unassisted cough peak flow, CPF. That's what will look at the strength of your cough. They'll sometimes look at assisted cough peak flow as well. They'll use a painless alternative to arterial blood gas sampling, such as a capnograph. That will measure end tidal CO2, which is the carbon dioxide in your exhaled breath, or transcutaneous CO2 monitor that will look at the CO2 level through the skin to determine your blood CO2 levels. Sometimes you'll get pushback from clinicians who will want to use arterial blood gas sampling. This is an opportunity for you to speak up, to self-advocate for yourself to get one of these painless alternatives. You may want to share with them that you're aware of the fact that some individuals end up getting an inaccurate reading on their arterial blood gas simply because they're fearful from the pain. It is taken from an artery as opposed to a vein. And through that fear, some of us will hypoventilate or hyperventilate, I should say, and we will see an increase in certain hormone levels that will alter the blood gas results. So an opportunity there for self-advocacy to ask for capnography or transcutaneous CO2 monitoring. They'll use a fingertip pulse oximeter to determine if blood oxygen saturation, O2 sat levels, are normal. And for adults, that would be 95% or greater. They'll capture your medical history, any surgeries that you've had, and any hospitalizations. They'll be particularly interested in whether or not you've been experiencing respiratory infections, whether you've had pneumonias. They'll also review any symptoms you may be having that could indicate a problem with your breathing and or coughing muscle strength. They'll want to know things like, are you nodding off during the day? Are you finding yourself experiencing some daytime sleepiness? Are you having difficulty staying asleep at night? Are you finding yourself restless? Are you waking with headaches in the morning? Things like that might indicate some breathing muscle weakness. At the end of the appointment, generally, they'll make a recommendation for when to return and or whether or not a sleep study is advised for you. Join us in our next presentation, part 3. This is where we'll explore where you'll find a neuromuscular breathing specialist. And of course, we encourage you to participate now through December 10 of the 100 days of the 15 and 100 movement. And we invite you to go to our website, breathewithmd.org. You can select the 15 and 100 link at the top of the homepage. It will take you to a page where you can learn all about this movement and how to get involved. And of course, if you have any questions, don't hesitate to contact us via info@breathewithmd.org. Thank you.